You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, full mouth extreme smile makeovers. My first guest calls it full mouth rehabilitation, reconstruction. With us we have board certified oral surgeon, Dr. Preston Hansen. Dr. Hansen, welcome to the program.
Hi, thanks Randy.
Now Nuvia, you have centers
Yeah.
all over the US, and you have, it's where everything gets done in one place.
Correct.
So who is your typical patient? Because I know you also do a lot of dental implants.
Sure,
But give us a working definition of this full mouth reconstruction. What is it?
I mean, full mouth reconstruction is a dental term, right? I mean, it's something we typically say to each other. Not a lot of patients are going to maybe walk around saying, I'm going to get full mouth dental reconstruction. But full mouth reconstruction, we're just talking about completely revitalizing, right, or rebuilding someone's smile. And that may be through a combination of procedures, right? Maybe they need some bone grafting, or they're missing some teeth, or some of the teeth they have are in really bad shape and need to be repaired. But full mouth reconstruction is essentially, taking a patient where they're at and the needs that they have, and in one go, giving them a full new set of teeth, right? A new smile.
A new smile. Yeah. All right. So you brought some photos. What are we looking at here?
Yeah, I brought a lot of photos. These are a bunch of before and afters of some of the wonderful people we've treated. And it really helps to kind of highlight how important this is, right? If you look at this before, and you immediately can see teeth that are different colors, right? We've got discoloration, staining, teeth that have been decayed, and the shape is incorrect, right? Or broken down. And so in the after, you can see with a combination of procedures, right? We give them a new smile, right? And this is this drastic before and after. And the reason these are so powerful is to demonstrate just how important this is.
Okay.
I mean, if you forgive me, a smile really is perhaps the single most important physical aspect of our lives.
Does not surprise me that you say that. So you're an oral surgeon. I mean, how important is a smile in your opinion, or teeth and gums in your opinion?
Oh, it's huge. I mean, if I could use an example, say, God, if you have if you're in the best shape of your life,
okay,
you got muscles for days, right? And you look fit and healthy, and maybe your hair, there's no gray in your hair, and there's no wrinkles in your skin, right? Okay. Perfect everything.
All right.
But you have a terrible smile, right? Either because of the decay we can see, or the discoloration, or maybe you're missing a few teeth. It doesn't matter what any of the rest of that looks like. You will be judged by your peers harshly. We are hard on people that do not have a beautiful smile. It upsets people. It turns them off to them, right?
Do patients tell you this? Like they feel judged?
Yeah. This is why I know this, because of all the stories. I mean, we've heard thousands of stories, right? And when you get judged, it affects things. It affects, God, am I going to get this job after this interview? Am I going to have another date with that person? I mean, it affects everything. But if you do the inverse, right? Okay. Maybe you're not the strongest person in the world. Maybe you're not the fittest person in the world. Maybe, you're like me, you've got some gray, showing up in your beard, or you've got some wrinkles in your skin. But if you have a really good smile that you're confident about, it cuts through all of that. None of that matters, because the smile is that important. And we don't think about it that much, but it is that important.
And you say once you do these extreme smile makeovers, they smile more.
Oh, absolutely.
They change in a way.
In some cases, they have to relearn how to smile. But while we're dentists, oral surgeons, right? But I would be willing to bet that, in addition to the oral and the physical health that improves in these people, I'd be willing to bet that their mental health improves too, right? I mean,
their mental health.
It probably
just because
does.
Their self-esteem improved,
yeah,
they're more confident.
The ability to have confidence, the ability to put yourself out there in the world and interact with people, is a tremendous driving force on mental health, one way or the other, right?
We talked a little bit about this on the phone too. That like Hollywood in the movies, the directors, when they want to make someone look poor or unclean or a street person, there are dentists that actually make bad teeth that clip over the good teeth
intentionally, right?
Just to make them look bad.
Yeah, it's that visceral, right? We're watching a movie, we don't realize it, but that's the story we're being told, and we know immediately about the villain, right? Because
they have darker teeth, like Halloween stores.
Yeah.
They all sell those clip-on buck teeth or crooked teeth.
Exactly. Yeah.
And when they get their full mouth rehabilitation, full mouth reconstruction, what's that like when they see themselves in the mirror for the first time?
It's really emotional for most people. I I think a lot of the pain and suffering that's built up is just released and gone all at once, and that can be overwhelming. I think they're just so overjoyed by it that most of our patients, that day they come back and have a look at their new smile, they cry, right? They're emotional about it, and often we cry with them too because we feel so lucky to be involved in that experience.
Now, what about patients that come to you and their teeth are pretty good, but they're just missing teeth in the back? You say that's very common. They're just missing teeth in the back.
That's really common.
What's the problem with that?
The problem with that is we need all our teeth for all our teeth to remain healthy. So if you're missing back teeth, over time, that's the support of your bite, right? The way your teeth come together. If you don't have those back teeth, there's nothing for them to rest on, and it can maybe put too much pressure on your front teeth, and now your front teeth start flaring out or shifting or moving, or even contribute to gum disease, right? The support structure around your remaining healthy teeth. So healthy teeth require other healthy teeth.
Okay, good. You have more photos. What else are we looking at?
I do. We've got a bunch of, here's a great one. Really drastic outcome, right? Same thing with this gentleman with a combination of procedures, right? Repaired and replaced teeth. So the result is a new smile, right? And if you look in that before picture, you can see a lot of space, right? Where the teeth are missing, there's space on the sides, right, around the corners of the mouth. And on the after, we've designed intentionally a beautiful smile that fits that person, right? It fits his mouth, and so it fills the space like it ought to, and it adds some youth and certainly adds sophistication.
Now, and you could do most of these things. You could do very quickly because you have like a lab. You have a printer that literally prints the teeth. You have a mill that makes teeth. You have designers that are actually painting and staining the teeth that are right there on site.
All the above, yeah. So at Nuvia,
is that why you do it so quickly?
That's part of what helps our efficiency. Exactly, yeah. It's actually really complicated. It's a lot of sophisticated steps that all depend on one another happening correctly in order to help someone have a new smile back that's appropriate for them.
Now, how does a patient know what their teeth are going to look like? Right?
Yeah.
On one of these extreme smile makeovers.
Yeah. Same thing. We're able to use technology that's available to us now that maybe wasn't available decades ago to take, for example, photos of someone as they are currently, right? In their current state with all the problems that are apparent, and then use design software and editing software to demonstrate to them what a final result might look like.
You could show them what their teeth are going to look like on the computer.
Yeah.
Okay. Yeah. Is it pretty accurate?
Yeah. It's surprisingly
Do they ever
accurate.
say, I want that?
Yeah, all the time. Sometimes people come in with pictures of other people that, this is the smile I want.
Are they surprised at how teeth, because look, we talked and, going into this, I always think, well, it's just teeth. But when you see how they look, so much differently in the after, are they ever really surprised at how it changes their appearance?
Yeah, absolutely. I think some people have just put up with something for so long and just convinced themselves that there's just nothing that can be done, right? And then when you take them through that process, because they finally chose to, I'm going to do something about this, right? I believe I can do something about this. Let's do it. When you take them through that, everything changes. Their perception of their appearance changes. You have all these external things that change, right? How people treat them. But there's all these internal changes too.
Now, when they get these extreme smile makeovers, you say they start going out to eat more.
Oh, absolutely.
I even jokingly said it's probably the most expensive thing about the procedure, going out to eat all the time.
Yeah.
Do you find that they become more active?
Yeah, absolutely. Well, just look at some of these pictures, right? If you don't have teeth, or the teeth you have are in such bad shape, you can't chew, you can't eat.
Okay.
So you're not going to spend time doing that, and you're not going to spend time doing that with other people because it's unenjoyable. And so the ability to suddenly do that the way it's meant to be done in social settings is a huge improvement to these people's lives.
Now, are there a lot of people missing 9 or more teeth across the country? Is that a big thing?
Surprisingly, there are. Our country has a lot of people. We have a lot of people that are missing all their teeth already. So tooth loss is a big problem. And it's funny you ask about a bridge because we really are at a point, I think, in dentistry where the standard now is really shifting towards dental implants, for example, right? If you're missing a tooth, the standard may not be anymore a traditional bridge. It may be a dental implant to
Get a dental
fill
implant.
that spot.
So that's the future of dentistry.
I really think so.
You're missing teeth.
Yeah,
Get an implant.
I think that's the first choice. Absolutely.
Okay, good. Let's take a look at what else you
Yeah.
have.
Yeah.
And for people just tuning in, we're talking about extreme smile makeovers, full mouth rehabilitation with the co-founder of Nuvia, oral surgeon Dr. Preston Hansen. Okay.
So here's a great one. All the things we've been talking about, right? You can see a smile on the before with missing teeth. There's evidence of loose teeth.
Okay.
And you can't see it from here, but there's decay and other problems in there, right? And failing dental restorations from the past.
Okay.
Right? So certainly someone that was going to benefit from, hey, reconstruction or full mouth repair, right? Full mouth.
Okay.
So this.
Look at the after, it looks good.
Yeah, this person was able to come in, and Nuvia was able to give him a new smile. Here's another wonderful patient that was treated at Nuvia. You can see right away all those problems, right? All the problems of missing, discolored, stained teeth. I mean, this person looks completely different. With
they
the new
do.
Smile, completely different.
They do. And when are they surprised? Like they probably, some of them have, you said, have never had a smile they were proud of.
Yeah.
Or never had a smile that they liked.
Many people can't remember a time when they felt good about their smile or when they felt confident about it. And it's really sad. I mean, that's a lot of life lived that way, right? So
They don't smile in photos?
Like
what do they tell you guys?
in a lot of cases they'll have a hard time finding a photo to show us what I once looked like, right?
Because they never smile.
Because they never smile. Because if you don't have confidence about it, it's so hard to do. You train yourself to, to hide and to kind of pull back from the world, and so it's tremendous when we can do something like this.
Now,
for
do you
someone.
have stories where it's like when you give somebody an extreme smile makeover, they start dating again, or they get married, or do people do this for occasions, like their daughter's getting married, son's getting married?
Yeah, I can think of a patient of mine from some years ago that we were able to do a full new smile, full mouth reconstruction for, and it was just leading up to his daughter's wedding. Kind of a common occasion, really, actually, for someone to try to change, do something big for themselves. And
Is there usually a tipping point, like somebody says something to them, or especially men, I guess they're in so much pain they want to do something about it?
yeah, I mean, it's all the above, really. There's occasions that finally are the reason. I mean, humans, I do think we like to give ourselves deadlines, or if this just happens, then I'll do this finally, or if I can just get to here, then I'll do this. But I do think whether it's an occasion or just being so overwhelmed finally with the problem that it is, one way or another, when a person decides to make this happen, and they come to Nuvia, where this is where we make this happen.
Okay.
The results are awesome.
Now, what if somebody, okay, not only do they have bad teeth, but they have really, really bad gums. Can they get one of these extreme smile makeovers?
Yeah, a common misconception is, oh, I'm in so much trouble, or I have such bad problems that I'm not a candidate, you can't help me,
Yeah.
right? It's not true at all. That's the treatment, right? The treatment is to solve those problems. So it doesn't matter what problem you want to come up with. Oh, I've got cavities, or my old veneers or my old crowns are failing, or God, I'm missing a tooth or two, or I have gum disease, right, as you say. I mean, if you have those problems, then the treatment for those problems is this. I mean,
And
that's what
Nuvia's
the treatment
concept is you have all the specialists right there.
We do.
So they don't have
We
to go to
do.
multiple places.
No, yeah. I mean, traditionally, it's common in the dental world to, start one place, maybe get a plan, and then maybe go to this specialist or that specialist, right? Different providers, different locations, different times, different waiting periods, all these things that, can become a burden.
Like you go to one doctor, maybe like the periodontist for the gum problems,
yeah,
or
exactly. Maybe you go to an oral surgeon, you get a bone graft and an implant, and then maybe you go to the orthodontist and straighten a few things, right? And it can grow to such proportion that it's extremely inconvenient and really rough on the experience. So the beauty of Nuvia is all that expertise in one location with all the technology and know-how to be able to help people conveniently and efficiently get what they want to
Let's talk about this for a moment, because dental insurance, even the best dental insurance, as you mentioned, maybe max payout per year is $1,500 to $2,000.
Yeah.
How many people are financing these procedures? Because you say that's very popular.
Yeah, it's a great question. Most people are. Most people finance this, and we have wonderful options out there. We have team members. Literally, that's their job, is to help people, find a good option, find something that fits their budget, so they can move forward with this and not let that be a reason to be held back. So Yeah, most people do finance it.
So for many of these people, they say it's life-changing.
Yeah.
Really?
Yeah. They all say it's life-changing.
Okay.
It really is. I mean, I can think of any number of examples. I can think of a middle-aged man who came and saw us, and he used, I don't hear this a lot, actually. We hear a lot of common things like, man, I've got this new job, or I've met this new person, or these things that change in their life. But this gentleman described it to me this way. He said, I feel like for the last 20 years, I've just been seeing in black and white, and now it's like color, right? Now
Really?
I see in color.
When they got their new teeth?
That was his definition,
smiles.
his way of describing, how drastic this change was and how meaningful it was to his life, which is awesome. I can think of another wonderful lady. This lady, I was slow to want to treat because she had all her teeth in decent shape, but her problem was really unique. They were so sensitive, and she tried everything, just everything. I had to talk to her twice because I just wanted to make sure, before we treat these teeth and restore everything, are you certain? Are we really certain? I had to talk to her twice, and we ended up going through with it and providing her with a new smile. And the amazing thing was, it wasn't so much, God, I can smile now, or I can, go to this event or this or that. It was, I haven't had a cold glass of water in 15 years, and my life is drastically improved because I can have a cold glass of water now.
Because it hurt before.
Because it hurt before, yeah.
Well, how do you take that away?
Through a variety of procedures, whatever they be, you restore and you replace.
Like gum recession?
Yeah, whether it's
like
gum
that
recession,
water, the cold water hitting her
sometimes it's
teeth?
just decay. Yeah.
Okay.
Sometimes it's sensitive teeth because of abrasion, or things wear over time. Whatever it is, and it's usually most of us have a combination of problems in our mouth. It's rare to have just this one single category, but whatever it is, when through coming into Nuvia and being able to go through this experience, drastically change your life, right?
Now, when you do these extreme smile makeovers, do family members ever comment to the doctors? Like say, oh, they're different, or?
Yeah, all the time. We have a lot of people who maybe grew up and they were like the life of the party type of personality, right? Or the jokesters, and they were the person that lifted everyone up. And then somewhere along the way, right, because of the problems that slowly built up over time in their mouths and the issues with teeth and gums and everything like that build up, they become maybe a little more discouraged, and they lose that aspect of their life. But they're now with people that knew them when they were, the life of the party, or knew them when they were that force for good.
And they're back.
And then when they're back, that can be in some cases more meaningful and certainly emotional to these family members who get to see, the reemergence of someone that they once knew and haven't seen for a decade or two.
Do you think in life, if something bugs you about yourself, it holds you back? Can you elaborate on that?
Yeah, I think so. I mean, we're so social, right? And unfortunately, too, certainly nowadays, we live in a world where, with social media and all the ways that we're interacting, there's more shame and to go around. There's more shame and judgment going around than there has ever been.
Okay.
I mean, I'm convinced that there's probably great ideas we haven't gotten to hear because of the fear of how we're going to treat one another. But it's certainly true when it comes to our looks and our smiles.
Because
so I think
95% of us is covered by clothing, and then there's your face, and your smile is right there.
Exactly, yeah.
So you mentioned this a little bit, but most of the people that I'm walking around and I see not smiling, or they look grumpy, or they look depressed, may just have bad teeth that they're hiding.
Exactly.
Is that possible?
I think that's actually true.
I mean, are they all over the place?
They're all over the place. And I say that because dentists will tell you this. I mean, anyone that's got dental training like I do, we can't help ourselves. I mean, that's what we look for.
So you can
I'm looking for people's teeth. Yeah.
Can you spot people that are hiding their teeth?
Yeah, I can see. I can tell. I feel like I can tell when someone's missing back teeth and maybe their bites collapsed a little bit because of the prominence of maybe a chin or something like that. And it's not like I have conversations about it because it's just going on in my mind. But people are all over the place out there, and almost certainly we've had bad interactions with people who are wonderful people.
Do you think
they
people
just are suffering from bad
hold
teeth.
back because they feel like they're even going to be judged by the dentist? Now, I know you have close to 50 centers across the country. Mm-hmm. Do you go out of your way not to judge people? I think you said something like that on the phone when we were talking.
Yeah.
Where you kind of meet them where they are?
Oh, absolutely. Absolutely. There's no judgment. I mean, I think in treating and helping so many people like this, we've learned to get completely past that, right? So nobody at Nuvia, nobody within a Nuvia location is going to have any qualms about that. They know that sitting in front of me may be the most amazing person I've ever met, and they just need a little help with their teeth. So,
is that right?
Yeah.
How do you find people that care, that like this?
That care?
Like
Yeah.
you know, the providers.
You know, we have a pretty selective process.
Okay.
We go through a lot of interviewing, a lot of discussions, because we're trying to tease that out. In many cases, it's not our technical skill as providers that's that important. It's our human skills, right? It's our ability to meet someone where they are, as you say, right? Have empathy, help them, right? Be willing to help. That's sometimes hard to find.
So do people come in, okay, we're talking about extreme smile makeover. So even with bad teeth, bad gums, whatever, you could turn that all around in most cases. Do they come in with low expectations? Like, I just want to be out of pain, or I just want to be able to eat better. Like they have no idea what this new smile, this new look is going to do for them?
Yeah, I do think, you know, the expectations are probably, they're a little broad. Some maybe are just hoping for one little thing to change. Maybe some have quite a list, but almost no one could fully anticipate the improvement that they see when they go through this treatment. Almost no one could say, I knew exactly what it was going to be like. I mean, that notion's common. I had no idea what I was missing out on.
Now, as far as technology in your practice, I mean, you're using a lot of things that make everything much faster, more precise, better looking. Could you tell me about that?
Yeah, that's a great question. I mean, the amount of technology that is now available, that has just come pouring into, you know, the dental industry in the last 5 to 10 years, is hard to grasp. I mean, whether it's our ability to get records, right? The way we get records, the way we take impressions is what I'm saying. The way we do that has changed drastically. I mean, in the old days, and still currently everywhere, people are still using regular impression material, which is, you know, that goop they squirt in a tray and then push up against
Makes
your
you
teeth.
gag a little bit?
Yeah, it makes you gag. It doesn't taste that great usually.
So you don't use that anymore?
No. We have technology now. We use scanning, right? We use optical scanning. It's clean.
Like cameras that go in their mouth?
Little cameras that go in the mouth and capture, you know, all the information we need about someone, way more precise, you know, than some of these other methods.
So that is uploaded to the computer, and you can design the tooth or the teeth.
Correct.
On that computer.
Yeah. Our ability to know everything about a patient's dental, you know, setup when they're no longer even in the office, we can keep working on someone's treatment plan at all hours of the day and keep it going.
Now we have time for a couple more photos.
Yeah.
And these are all people that have had extreme smile makeovers at Nuvia. Here's another patient.
Yeah, so another patient that came in with, you know, a combination of problems, and fortunately through a combination of treatment and procedures, we're able to help provide a new smile.
Looks good.
In one day.
And these are endless. I mean, I go to your website, you just have photo after photo after photo.
Yeah, it's amazing. I know I just have this small, but there are thousands. I mean, there's so many people that have gone through this.
Now for these complex full mouth reconstructions, you're big on sedation dentistry.
Yeah, we're huge on. I mean, that's one of the biggest reasons people avoid the dentist is because of the discomfort, right? The pain. Right?
Yeah.
They don't want to. They don't want to have. So at Nuvia, we have an anesthetist, right? That's part of the team. Part of the team of providers is anesthesia, and so someone can come in and be asleep, right? They can sleep through this procedure, and not have to be awake for the work that that needs to be done, and that's huge. In many cases, that is the one single thing holding them back.
Is that part?
There's every other reason to do it. Just that alone is the reason I cannot.
The fear of the dentist.
The fear of that experience. So that's been a wonderful thing to be able to
So
provide.
how safe is it?
Oh, it's tremendously safe.
Like, what do you monitor?
Oh, we monitor everything. I mean, it's first of all, there's preoperative work, right? We do med clearance to make sure that everyone's ready, all preparations are made, we know everything we need to know to proceed safely. I mean, when someone comes in and has anesthesia, we're monitoring all the vitals, right? Breathing, heart, all that stuff, oxygen.
And they wake up with a new smile.
And they get to wake up and have a new smile and not experience the bad part.
Or even the next day, within 24 hours.
Yeah, so Nuvia specifically, someone comes in and has work done. In 24 hours the next day, we're able to provide a permanent
because you're printing, milling the teeth,
making
all
it
right
all
there.
on site. Yeah.
Final message, somebody watching this. They have bleeding gums, bad breath, really bad teeth.
Yeah.
And they're skeptical. They haven't been to the dentist maybe 10 years.
Yeah.
You say some people haven't been to the dentist in 10, 15 years to see you.
Yeah.
But they want a great smile to look like some of these patients. What do you say to them? They're afraid.
Yeah. Simple message is don't convince yourself that there's nothing that can be done for you.
Okay.
We've met so many people from every walk of life with every dental problem and combination of problems that you could imagine. There's nothing new, right? There's nothing new we haven't seen. We invite everyone to come in. Okay. Please come in. Come meet us. Meet
Is
our
it a
providers.
free consultation?
It's a free consultation. Be able to get a 3D X-ray, right? Do all the diagnostic data and be able to look and find out what the options are.
And you're going to show them their teeth on some sort of a screen?
And we can do
what they
digital
can look
mock-ups.
like?
We can show what the future could be. Yeah, it's a wonderful experience. I invite everyone. It's an open invitation. Please come in.
Okay, good. I want to thank you for coming on the show. And your website's pretty sophisticated, so they could make an appointment online, or they can call your office. What do you prefer?
So typically online is a great place to start because we do have like an eligibility quiz that helps go through and ask questions and finds out about what's going on with someone so that we know how to help them from there. But they can certainly call the office as well and ask to make an appointment. We have a lot of people that are very kind and willing to help get anyone in that wants to see us.
So this is not for everyone, but if you don't like your teeth and gums, might as well do something about it.
Yeah. Well, you might as well go
and you have financing.
You might as well go to an expert in smile restoration to find out what options and maybe where you should proceed with, right? So
okay.
We're the experts in this. Come see us.
Everybody that comes on my show is convinced they're different.
Yeah.
But you're one of the first people when we were talking on the phone that really convinced me that you guys are different.
Yeah.
Do you really feel like you're that different?
I really do. And it probably shouldn't be the longest story, but the dental world has actually got fascinating stories of innovation and the development of how things have been done. And you can go back to the 50s and 60s and the 80s and 90s, and you can find stories where someone proposed something and they were just, laughed out of the building or criticized, when all they were trying to do was make something better. And the same thing in the 80s, right? And so we build and we look at that legacy and we use that to...
Because you've innovated quite a few procedures, you say.
Yeah, we have processes that nobody else is doing that allows us to be that unique point. Our ability to provide a new smile in 24 hours, that's not made of temporary materials, right? Final, beautiful materials that quickly.
Very nice.
Is part of our value
All right.
that we offer.
I want to thank you for coming on the show. Good stuff.
Thanks, Randy.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.